Everything inside of me was telling me there's something else wrong.
It felt like someone was pulling the bones in my neck apart. I thought I was gonna lose them.
He said you're gonna have to have surgery, and if you don't, it could be the end.
Next, 3 medical mysteries that defied the experts. Sean Towery is a perfectly healthy 25-year-old until crippling attacks of dizziness strike, and no one can tell him why.
I kept pushing him. You need to find a reason. You need to find what's caused this.
Then, bizarre headaches and spasms begin taking over Angie Abbas's life, but her doctors don't believe they're anything to worry about.
And I told my mom, you can fight my battle for me because I just didn't have the strength to do it anymore.
And Nicole Bonfig, born with a heart condition. But it's her mysterious stunted growth that has her mother running from doctor to doctor.
I was getting really worried and I was frustrated because I felt like nobody was listening to me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. For Sean Towery, childhood is a carefree time. The only problem he seems to suffer from at all are his chronic ear infections.
I remember the ear infections starting when I was about age 5, and they were the type of ear infection where you'd have blood and pus, keep you up at night.
The physicians would prescribe an antibiotic, and in a few days it would clear up. And then as he got older, it started to get more persistent.
Then, when Sean is 13, he visits a new ear, nose, and throat specialist who orders a CAT scan.
We sat down, he looked in my ear, held up the films from the CAT scan, and instantly said, "You're having surgery."
What the doctor sees on the CAT scan is a cyst deep in Sean's left ear. It's a cluster of dead skin cells called a cholesteatoma. If they don't remove it, it will continue to grow and could do permanent damage to Sean's hearing.
He explained it that he had to remove it, and then that was the cause of the bleeding and the drainage within my ear. I had surgery roughly a month later.
The surgeon goes in through Sean's ear and cuts out the cyst. The entire procedure takes less than 5 hours and goes off without a hitch.
And it was wonderful. And he never had problems after that.
For the next 13 years, Sean is completely symptom-free. No pain, no hearing problems. He seems to be in the clear. Then, when he's 25, something terrifying happens.
January 2004, got up, had my morning coffee, was going to get ready for work, and took a shower, stepped out of the shower, grabbed tissue to blow my nose, and instantly the room just started spinning out of control. My balance was unsteady. I was vomiting. I was shaking. The bottom half of me was flushed, but my face was very white, very pale.
He could not walk, weaving side to side. I was extremely worried.
Sean's family drives him straight to the emergency room.
When they saw me, they instantly thought, okay, we have a heart attack victim.
And I was very, very alarmed because I couldn't get to him. I couldn't be there to help.
They put me on the bed, bang, EKG right away.
The EKG shows that there is no problem with Sean's heart, but given Sean's history of ear infections, the ER doctor goes on to examine his ears. But he can't see anything wrong there either.
And at that time, he stressed, I feel as if something else is going on here because you do not have any inflammation in your ear. It made me think, what else is going on now?
The ER doctor prescribes some drugs for motion sickness and recommends that Sean get an MRI.
At that point, my job did not have benefits, so I was unable to afford such a procedure.
Sean puts off getting the MRI. 1 month later, he moves to Texas for a new job in a college recreation department. He's at work when an odd new symptom appears.
He told me that he could feel like movement in his head. When he would move his head suddenly from side to side, that he could feel something loose inside his head.
If I was active, if I was playing a sport, I could feel something moving on the left side, and that was frightening.
I was very worried, I'll tell you. I didn't know what to do, but I bugged him to go get that MRI.
So we were back and forth, I can't afford it.
But I kept pushing him. You need to find a reason. You need to find, what's caused this.
But before Sean can schedule the MRI, disaster strikes.
So in September, I get on the plane to head back to Michigan for some weddings. We take off, everything's great. About 30 minutes into flight, a series of pops in my head, and they're in the left side of my ear. The last one is so loud that it's like a mousetrap. I instantly lose hearing in that ear, and the plane starts spinning out of control. I am getting violently ill. I'm hot, I'm cold, I'm hot, I'm cold, I'm vomiting.
Sean white knuckles it all the way to Detroit. Once he lands, his family rushes him to the emergency room. But when the doctor examines his left ear, all he finds is a mildly perforated eardrum.
And they said it was just a slight perforation, a little bit of dried up blood, nothing to be really concerned about. And I try to tell them, same symptoms as before, and they're like, well, this probably is the reason, and, we're gonna give you some medication and you're gonna fly home.
The ER doctors give Sean Valium and motion sickness drugs for his flight home, and they urge him to see an ear, nose, and throat doctor. The drugs ease the pain, but it's clear to Sean and his family that something is still wrong.
I noticed that he wasn't hearing hardly anything I was saying, unless I positioned myself on the right side of him.
The dizziness is now constant and debilitating.
You felt like you're walking around in a drunken stupor. For weeks on end is how I felt.
Then Sean's primary care doctor refers him to Dr. Richard Hung, one of the top ear, nose, and throat doctors in Texas.
We let Sean give his whole story. He had symptoms of severe hearing loss and some vertigo and dizziness. But then when he started telling me that a year ago he blew his nose and that caused dizziness, and that really raised my suspicion for a possible inner ear fluid leak.
2 fluid spaces within the inner ear help to maintain balance, but Dr. Hung must conduct dozens of tests to find out if that is where Sean's problem lies.
Did a couple of the little hearing tests, failed. And he said, okay, well, we're gonna try a little balance exam.
And for that test, we lay them flat very, very quickly to see if we can stimulate any kind of vertigo or abnormal eye movements. And sure enough, on the left-hand side, he actually did have some abnormal eye movements.
The test indicates that Sean could have benign paroxysmal positional vertigo, a common inner ear condition that causes severe dizziness.
The only problem was that patients with positional vertigo do not have any hearing loss at all. That was an abnormal finding that did not quite fit with his story.
Dr. Hung is baffled. He orders a series of sophisticated balance exams. The tests turn up some unusual results, but still no answers.
And he's like, well, we're definitely doing the MRI, and we're doing a CAT scan.
Finally, on the CAT scan, Dr. Hung sees what appears to be the problem.
We found that there was an abnormal fullness inside the middle ear that was actually suspect for maybe another cholesteatoma, a recurrent one from 13 years ago.
He told me that I was gonna have to have surgery of some kind to remove that. I knew my hearing was gone. My fear was that the pain, the movement, all those things, I just knew it was going to be something worse than, what I had when I was a kid.
Dr. Hung refers Sean to specialist Dr. John Ogilvie.
When Sean came to see me, he brought a CAT scan of his ear with him. On that CAT scan, it was clear that Sean had a major problem.
He gets out his little pointer and he's showing me, okay, here's what Dr. Hung thought was a cholesteatoma cyst, and in fact, that's your brain.
There is a hole in his skull, roughly the size of a quarter.
Basically, my brain had worn through my skull and had fallen in my ear.
Sean is diagnosed with a temporal lobe encephalocele, an extremely rare and dangerous condition where a hole develops in the part of the skull that separates the brain from the ear. The hole may be a congenital defect, or it may develop over time as a result of repeated ear infections or other conditions.
The moving that Sean felt behind his ear was his brain. Every time he bears down to lift something heavy, his brain was being pushed down into his ear. I think the pressure changes that Sean experienced on that plane trip broke the camel's back. The last thin remnant of bone between his brain and his ear broke, and that's why it was so loud to him.
I was in complete and utter shock. I'm thinking, okay, how is this gonna affect me? I mean, am I gonna be brain dead? You know, what are the ramifications?
It scared the daylights out of me. It truly did. I thought I was going to lose him.
I mean, it was as simple as you could put it. In order to correct this, you're gonna have to have surgery, and if you don't, you know, it could be the end.
The surgery is scheduled. It's 4 weeks away. If Sean gets sick before then, it could be fatal.
In Sean's case, there's no protection between his brain and his ear space. So if he ever got an ear infection, it would rapidly go to his brain and cause meningitis. That's a life-threatening condition.
Each day is an agonizing wait. And then suddenly, a new symptom appears.
He had a lot of discharge out of his nose, and it was just clear liquid, and at first we thought it was a cold. But he had called Dr. Ogilvy, and they had said that it may be brain fluid.
Sean Towery has just been diagnosed with a hole in his skull. Brain fluid is leaking out of his nose. Now, his surgeon must perform an operation in an attempt to save Sean's life.
They were gonna actually have to drill a hole in the side of my head to move my brain out of the way.
There are many potential complications to this. The risks of this surgery include a stroke, brain damage. There's a big risk of seizures after this type of surgery.
At 10 a.m. on November 10th, 2004, Sean is wheeled into the operating room.
When they took him away, I just said, I'll be here when you come back.
The surgery should take 4 hours. Dr. Ogilvy will repair the hole in Sean's skull with layers of muscle, bone graft, and titanium plate. But upon opening the skull, he's surprised by what he finds.
When we opened up Sean's ear, we found the brain in his ear. But interestingly enough, we also found a cholesteatoma, a cheesy whitish material. So he had two problems. He had the brain coming down into the ear, and he also had a cholesteatoma going up into his brain.
Dr. Ogilvy also discovers why Sean has experienced such severe vertigo.
The cholesteatoma had actually dissolved the bone around his inner ear and had gone into his balance canals. And that's why he was so sensitive to pressure.
The surgery will now be much more complicated than Dr. Ogilvy had anticipated.
We not only had to bring the brain back up to where it belonged and to repair the hole in his skull, but we also had to remove all of the cholesteatoma so that it would not come back.
So we waited. And we waited. And we waited.
The nurse in the OR would call the waiting room, and I could hear the saw in the background, and that was probably the worst sound I've ever heard. And it was horrible. I was scared. I was devastated. I was worried, you know, what happens if there's a slip, you know? Does he become brain dead?
After almost 7 hours, Dr. Ogilvy completes the final stage of the surgery. And the news is good for Sean's family.
The surgery went fine. I was tired at the end of the day, of course, but there were no complications at all.
Dr. Ogilvy came and talked to us and told us that he probably would not get his hearing back, which at that point, I was glad just to hear everything went okay. He still has an ear, he can hear me, and so we're fine with that.
5 days later, Sean is discharged from the hospital.
I felt pretty good about 10 days after being released from the hospital.
He stopped complaining of the dizziness, and he said he didn't feel movement in his head anymore. It seemed back to normal.
After suffering 10 months of discomfort and pain, Sean feels lucky that he finally got the right diagnosis.
If the diagnosis was not found, this cholesteatoma would most likely continue to enlarge. It might have even gotten infected, causing an infection of the brain, and it could be fatal.
The reason it's hard to diagnose a temporal lobe encephalocele is that it's so rare. Most doctors will never see a case of this in their lifetime.
1 year later, Sean is healthy again, but his medical ordeal has changed his life.
My balance is not perfect. It's not like it used to be. And I'd say that's about the only limitations I have other than the hearing.
Sean's long-term prognosis is excellent. I think the chance of his temporal lobe encephalocele recurring is slim. We will have to follow him with periodic CAT scans and MRI scans the rest of his life.
People wait all the time to go see a doctor for something, to the point where they can't do anything for you. Be proactive. Don't procrastinate. If something's wrong with you or someone else, don't be afraid to tell the doctor.
An operation saved Sean's life and cured him of most of his symptoms. But when Angie Abbas falls ill, it seems as if there's no solution in sight.
My migraine started when I was in the 4th grade, about 9 years old, and they were really bad.
The doctor at that time decided to send her to a neurologist, and everything came back negative, and he just classified her as having typical migraines.
After a couple of years, the headaches slowly diminish.
They never really found a reason and thought she kind of grew out of it.
Then, when Angie is 16, the migraines come back, worse than before.
It was like a sharp stabbing pain over my right eye. After like a month or two of it, they would get so bad where it would hurt just to like move my jaw. Like I could not speak.
She would oftentimes throw up, sometimes several times a day.
Angie tries taking over-the-counter drugs, but nothing helps. The family doctor prescribes pain relievers, but they don't work either. And around the same time, another symptom appears.
Her hands would be blue, Angie's feet would turn blue, and she just was cold all the time. And, you know, we live in North Iowa. You don't think that much about somebody being cold because it's cold.
Then, one morning, the headaches and poor circulation are eclipsed by something much stranger.
Angie woke up and came down the steps, and when she came down the steps, her head was moving like this.
I thought, well, this is weird.
So I immediately called the doctor's office.
We drive over there, and you know, my mom is like gripping the steering wheel, and she is so positive that it's a brain tumor. And
the doctor came in. He was very, very serious and started doing a more thorough exam.
During the exam, the doctor discovers something nobody was prepared for.
And he said, I think she's pregnant.
Three months ago, 16-year-old Angie Abbas began suffering from agonizing migraines, nausea, and mysterious neck spasms. Her family fears she has a brain tumor. Then her doctor discovers something no one expected. Angie is 20 weeks pregnant.
And it's just like, okay. It was a shock to, you know, I didn't want to look at my parents' faces.
Our first thoughts were, we can handle a pregnancy a lot easier than we can handle a brain tumor.
And so my mom and dad and I went to the ultrasound and found out it was a boy. I knew I wasn't ready for that kind of responsibility, so we looked into adoption.
Angie's headaches and vomiting are now attributed to the pregnancy. But that still doesn't explain her neck spasms. So 1 week later, the doctor refers Angie to a neurologist.
She didn't know why I was twitching. She said, it's some weird thing that you've got going on, but, you know, it seems to be okay, you're fine, and the baby's fine.
And the neurologist said, I want you to take this blood pressure medication. That might help with controlling the migraines, and otherwise I'll see you after you have the baby. And dismissed us.
Then, after 5 days, the spasms suddenly stop.
So, you know, we just all assumed that it was an isolated instance and didn't think too much of it.
10 days later, it starts up all over again.
And it was stronger this time. It felt like someone was pulling the bones in my neck apart.
I've never seen anything like it. It was almost like the movement of a bird.
Michelle immediately dials the neurologist.
And she said, you know, I really don't need to see her. It'll be okay. And I'm thinking, she, again, just kind of brushed us off.
Within minutes, Michelle gets another call. It's the OB's office. Angie's blood work has come back abnormal. They need to retest her.
She said, you know, I think it's some clotting thing that they are looking for. And I said, a clotting thing? I said, you know, my dad had a stroke at the age of 43. And before that, he had pulmonary embolisms. And we never knew why.
They go in for a repeat blood test. A few days later, the OB calls with the results.
And he started going through the list, and one of them came back weakly positive.
The slightly elevated number is for an antibody called anticardiolipin. The doctor doesn't think it's high enough to be of concern, but Michelle does.
I started doing more research, and I found a syndrome called antiphospholipid antibody syndrome, or APS for short.
Antiphospholipid antibody syndrome, or APS, is a deadly blood clotting disorder. It can lead to strokes and heart attacks, and in pregnant women, it can cause extremely high blood pressure, a dangerous condition called preeclampsia, which can be fatal to both mother and baby.
I was very scared. I knew that this was something big.
As Angie closes in on her third trimester, her neck spasms are getting worse. Frantic, Michelle makes an appointment with another neurologist.
She basically said that it was nerves and hormones, and being 16 and pregnant was hard to deal with, and so that's why I was twitching.
I did bring up the fact that Angie had tested weakly positive for the anticardiolipin antibody.
And she just, kind of passed it off as, some people have higher numbers when they're pregnant.
Scared and frustrated, Michelle goes online again to look for answers.
As I was doing the research on some of these clotting disorders, I read that during pregnancy, there is a great, great chance of a stillbirth occurring. And a lot of these mothers would be put on shots of blood thinners and baby aspirin.
Despite doctors' assurances that her daughter is fine, Michelle is convinced that Angie's problems are rooted in more than just a difficult pregnancy. She starts giving Angie a daily dose of baby aspirin to thin her blood and asks that another series of blood tests be run. 1 week later, the results are back.
And she said, here are the numbers. Again, they came back slightly positive, but they're not going to do that APS diagnosis.
And she was saying, there's something wrong with her. You need to find out what's wrong. And they were saying, no, her numbers are not high enough.
Michelle was scared to death. She was shaking when she came to the waiting room to talk to me.
And it told my mom, it's up to you now. You can fight my battle for me, because I just didn't have the strength to do it anymore.
Angie is suffering, but tests aren't showing anything definitive. Then, 8 weeks before her due date, everything changes.
I woke up on July 25th, 2004, and threw up. I went downstairs and I said, Mom, I threw up.
Michelle is alarmed. Angie has not been vomiting since early in her pregnancy. Then she notices something else.
I did notice that she was having a little swelling in her ankles, and I thought her face was a little bit puffy.
Michelle's instincts tell her something is very wrong. She rushes Angie to the hospital. The OB on call is a doctor they've never met, Dr. Michael Faust.
Her blood pressure was quite elevated. She had some swelling. With those symptoms, it tells us that Angie was at risk for preeclampsia.
It was what Michelle had feared all along.
Left untreated, preeclampsia can lead to strokes and brain injury for the mother, and ultimately will lead to, probably fetal death as well.
With Angie's blood pressure skyrocketing, the doctors have only one option.
The treatment for preeclampsia is delivery. We can give medicines to buy some time until delivery occurs, but delivery is the treatment.
An emergency C-section is the only way to save Angie and her baby.
I was very scared. In fact, I even looked at Dr. Faust and I said, if it comes to the point where it's Angie or the baby, I said, will you please save Angie? And he said, I'll save them both.
Angie Abbas has had bizarre symptoms throughout her pregnancy. Now in her 32nd week, her blood pressure has shot through the roof, and she's developed a severe case of preeclampsia, which could kill her and her baby. Her doctors rush her into the OR for an emergency C-section.
They gave me a spinal, and 2 minutes later I was being cut open, and I could feel the knife on the left side of my body.
And it was just within seconds, we heard the baby crying.
The premature baby is 3 pounds, 11 ounces. He's rushed to the neonatal intensive care unit. And Angie's also in danger. Her blood pressure is still sky high from the preeclampsia.
The thing that Michelle kept talking about is that Angie could throw a clot, and that it could pass through her heart or her lungs and either cause a stroke or could kill her.
Dr. Faust puts Angie on medication to protect her from possible blood clots and moves her to a recovery room. Then he calls in the hospital's chief hematologist, Dr. Walter Bate. Michelle tells him about Angie's elevated anticardiolipin count and her concern that her daughter has APS. But Dr. Bate explains that it is not that easy.
It is not a clear-cut syndrome. It's not like saying someone has a heart attack. They either do or they don't. With the APS syndrome, there's a lot of subtlety to it.
And most importantly, Angie has one symptom that doesn't seem to have anything to do with APS.
He had never seen anyone doing the twitching like Angie was doing.
Michelle goes back to the stacks of research she's collected, and this time sees something she hadn't noticed before.
Michelle emailed me some articles where it had been shown that young women with the APS syndrome had been found to have some movement disorders in a very few number of cases. I was quite surprised by that.
The articles are enough to convince Dr. Bate. He sets an appointment with Angie and her mom.
I looked at them and said, well, I have concluded that Angela has the APS syndrome.
I said, you mean you're giving us a diagnosis? He said, yes, I am. I wanted it to be wrong, but yet I knew in my heart it was right.
Antiphospholipid antibody syndrome is an autoimmune disorder also known as sticky blood syndrome. Antibodies attack fat molecules in cell membranes, causing blood cells to clot excessively. These clots can go on to block an artery or vein and lead to a stroke or heart attack.
It was a mixed feeling. It was kind of like kissing my health goodbye. And I knew I was never going to be a regular teenager.
Angie's pregnancy may have saved her life. Pregnancy causes a woman's body chemistry to change and blood volume to increase. This made the APS worse and brought Angie's symptoms to the surface. Had this not happened, she could have gone undiagnosed until she had a stroke or heart attack and died. There's no cure for APS, but to prevent the deadly complications from clotting, Dr. Bate puts Angie on blood thinners. This finally reduces the twitching and other symptoms.
Angela had a very unusual manifestation of a very rare disease, which is why it was so difficult for people to recognize what was going on.
1 year later, Angie is back in school. The baby has been adopted, and his parents have named him Cameron.
I really feel that Cameron was our little messenger that let us know that Angie had this clotting problem.
Angie has grown close to Cameron's parents and is part of the child's life.
I think it's extremely important for patients to really get involved because the doctors can't read your mind. They can't tell how you're feeling or what you're thinking. You have to tell them because they won't know unless you say something.
Angie's symptoms masqueraded as side effects of a normal pregnancy. But when Nicole Bonfig is born, it's clear that she's sick, even if doctors don't know why.
When she came out, she was purpley looking. She looked kind of swollen a little bit. and not pink like, you think they're gonna come out.
And shortly thereafter, they took her out of the room and didn't really explain a whole lot. I didn't know exactly what it was, but I did sense that something was different with this birth than the first one.
The next morning, the doctors tell the Bonfigs that there's something wrong with the baby's heart.
So they were gonna bring her to another hospital that had a pediatric intensive care unit where she could be watched. And they whisked her away.
At the new hospital, a cardiac team examines the baby and orders a battery of tests. Finally, on the echocardiogram, they see the problem. Nicole has a congenital heart defect. Her aortic valve is misshapen and could block adequate blood flow to the rest of her body. The doctors decide to monitor her heart to see if the valve does indeed start to malfunction.
They did echoes every day, and then on Thursday they did another echo. And her valve had functioned pretty good.
It was painted as a fairly mild situation, that it wasn't something that we would have to worry too much about in the short run.
And so they said, you do need to do a checkup in 2 weeks and see how her valve is doing then. And they sent us home the next day.
At Nicole's follow-up appointment, everything checks out just fine. But in the weeks after that, things take a turn for the worse.
Each day it seemed like, things just weren't right. I weighed her every day at home, and she was gaining, a little bit, but only a couple ounces. And she nursed much more frequently than Emily did. Every hour and a half.
And she literally she couldn't feed more than 5 minutes at a time. Feeding was wearing her out.
More and more, when she'd nurse, her face would get really dark, and that meant she was working really hard while she was nursing. And I remember a Friday calling this doctor and wanting to talk to him, and I was worried about her. And I said, she's not gaining weight, she's dusky when I feed her, she's feeding all the time. I said, and these are all signs that you told me of signs of heart failure.
The cardiologist tells Natalie that it can wait until their next appointment. But Natalie can't wait and immediately makes an appointment with a new cardiologist.
He tells me he's gonna do 3 tests. He's gonna do an echocardiogram, he's gonna do an X-ray, which will show whether the heart is enlarged or not, and he's gonna do an EKG, which will measure the heart rhythm.
When the tests come back, it's bad news. The results show that Nicole's aortic valve has gotten so narrow that she could go into heart failure any day.
And he says she needs to have open heart surgery, and she needs to have it this week.
Six-week-old Nicole Bonfig is in the hospital fighting for her life. She has a heart defect that, if left untreated, could kill her within days. Surgery is her only option.
What they were going to do was perform what's called an aortic valvotomy. They take a scalpel and they go to the little opening in this valve and they make that opening bigger. This scared the daylights out of me.
And you're just thinking, why is this happening to us? What is she gonna live? Am I gonna see her in a couple hours?
The possibility that Nicole would die was very, very real.
They come and wheel her away, and you think maybe you never see her again. I just don't know.
It's the most frightening weight of their lives. Finally, the operation is over, and the surgeon has good news.
He said, I believe it was very successful, but we still have to monitor her and see how well she does.
Nicole's aortic valve is now the size it should be. The doctors tell the Bonfigs she may need surgery again when she's older, but for now, Nicole has a functioning heart.
So we knew that we'd watch her heart, and I thought, well, this is it. She's going to be our heart baby, our heart child.
I think that they, went home thinking that it's going to be good for now, and we're just going to kind of see how it goes and, hope for the best with the valve, not thinking that maybe there was anything else wrong.
Hoping the worst is behind them, the Bonfigs bring the 6-week-old infant home.
After she recovered, she started moving around, kicking her legs, kicking her arms. And I'm just like, look at her. She's just moving around like a normal baby. She just looked wonderful.
Things are looking up, and for a while, Nicole flourishes. Then, at 5 months, it all begins to change.
Nicole seemed to get sick fairly often, mostly ear infections.
All kids have ear infections, so I really didn't think anything of it. And, after what we'd been through, an ear infection,
But every couple of weeks, Natalie was taken to the doctor, and she'd be on one antibiotic or another.
So in May of that year, she had tubes put in. You do kind of ask those questions. She's got heart problems, she's got ear problems, but no, they're completely separate.
But as the weeks go by, Natalie starts to notice something even more disturbing.
Nicole did not progress, I would say, at a normal rate that first year, weight-wise or developmentally.
She literally wasn't growing. She wasn't putting on weight. She wasn't very tall.
I mean, at the age of 6 to even 8 months, she still looked like a newborn baby.
Nicole couldn't even really sit herself up till about 10 or 11 months.
And she would go to the doctor, and they kept saying, well, it was because of the open heart surgery. That just set her back that much more, so that's the reason why she's not growing.
That's a believable scenario. We saw what Nicole went through, and that makes some sense. She's going to catch up.
But Nicole does not catch up, and as the months wear on, she falls further behind.
Nicole did not grow 1 pound from the time she was 2 until she was 3. She did not gain 1 pound. We had an outfit I bought her. She wore it for 2 years. She wore this outfit out. The doctors just kept saying, she's doing fine, her growth's fine, her weight's fine, she's on her own little curve. And everything inside of me was telling me there's something else wrong. I knew it wasn't her heart. It really wasn't her ears. I mean, I was getting really worried, and I was frustrated because I felt like nobody was listening to me. Nobody would say, you're right, there is something else wrong.
Three-year-old Nicole Bonfig had open heart surgery when she was a baby, and it saved her life. But now she has stopped growing, and her doctor has no idea why.
And I remember very vividly him standing there going, she hasn't grown at all this past year. And I was like, yes, I know she hasn't. And what do you think's wrong with her? I mean, it was like I pounced on it when he said that. I was like, yeah, okay, well, what? And the cardiologist said, I want to send you to an endocrinologist.
That endocrinologist is Dr. Joseph Sokolowski, a specialist in hormone and growth problems.
I got a call from Nicole's heart specialist, and he became concerned that she was smaller than he would have expected. Nicole's height was more typical of a 2-year-old, and she was almost 3. And her weight was more typical of about an 18-month-old.
Dr. Sokolowski must determine whether Nicole is just a late bloomer or if she has a growth disorder.
I then did a complete exam from head to toe, looking for anything that might suggest an underlying medical condition that could cause a child to not grow.
He looked her back, her legs, her arms, her chest, her face, under the back of her neck, everything.
Her exam was essentially normal with 2 minor exceptions. She did have a high arch to her roof of her mouth, and she had a greater distance between the nipples on her chest.
These irregularities could be a sign of a serious disorder, but Dr. Sokolowski must run a series of tests to find out what it is.
We did some blood tests to look at her kidney function, to look at her thyroid function. In addition, I ordered a chromosome analysis or a karyotype.
He said the test results will be back in a month and we'll contact you. And then he sent us home.
Chromosomes are the thin, rod-like structures found in every cell that contain our genetic information. A chromosome defect can be devastating to a child's development. The next 2 months are the longest wait of Steve and Natalie's lives. Then, finally, the results of the karyotype come back.
I made a call to Nicole's home, initially spoke with her father, and told him that I thought we had an answer to why Nicole was smaller than every other girl of her age. And I said that she had a chromosome problem called Turner syndrome.
Turner syndrome affects 1 of every 2,500 girls. Normally, girls are born with 2 X chromosomes in each cell. Turner girls are born with only 1 full X chromosome. This means there is a large portion of genetic information that they just don't have. These missing genes caused all of Nicole's health problems: her heart defect, ear infections, and stunted growth.
Short stature is probably the single most common problem that these girls face. They're also at greater risk for a digestive system problem called celiac disease. They may have some progressive hearing loss. They can have enlargement of the main artery that leads out of the heart. And if that were to progress, it can rupture and lead to a very rapid death.
I didn't know what to think outside of, here we go again. On top of all we've been through already, it was just like, it's one more thing. And one more big thing.
There is no cure for Turner, but the problems it causes can be managed.
You're trying to deal with a dynamic situation that's always changing. There's always new things to look for. At every stage of her life, there's going to be something to look for.
Turner girls can be diagnosed at birth if they demonstrate some telltale symptoms, which Nicole did not.
At birth, she did not have any unusual puffiness of her hands or feet. She did not have the extra skin fold in her neck. And while she did have a congenital heart problem, it was the kind of problem that occurs in a lot of otherwise normal children.
Dr. Sokolowski immediately puts Nicole on a daily regimen of growth hormone.
When Nicole went on growth hormones, it was amazing. She started growing.
First year she grew 5 inches, and we were thrilled.
Because Nicole was started on growth hormone so early, her doctors expect her to reach a normal adult height. As a teenager, Nicole will begin estrogen treatments to kickstart puberty. Although she will develop the features of an adult woman, Turner girls are generally infertile.
Probably the hardest part of all this has been having to tell her that she has to adopt children, because it's hard to tell a little girl that. When I told her, she had a couple questions and she was kind of like, okay. She accepts everything very, very well.
Today, Nicole is a happy, well-adjusted 9-year-old.
Something that makes me different is I'm a little bit shorter than some people, but it doesn't make you too different from everybody else.
She is doing great in school. She's smart, she's bright, and she's athletic. She's done very well. We've been incredibly fortunate.
Nicole will and should be able to do pretty much anything she wants.
I would say to another girl who just got diagnosed with Turner syndrome that you'll just be a little bit shorter and you have to take a shot, which you'll get used to, and it won't really be any different.
Nicole's diagnosis has taught Natalie a valuable lesson.
You can't just listen to what the doctor says. If your gut tells you something else is wrong, you have to follow your gut.